Hi, my name is Purvis, and today I'm going to be demoing a chest tube dressing change. So the first thing I'm going to do is I'm just going to be checking the doctor's orders, making sure that we have the right patient and we gather all the supplies that the doctor wants us to use for this procedure. So I've gone ahead and I've collected all of those supplies. So now I'm just going to go ahead and head to the patient's room. I'm going to go ahead and I'm going to wash my hands, and I'm going to do my entrance safety check, making sure that the patient's in no distress. Call bells within reach, side rails are up as appropriate. From there, I'm going to go ahead and I'm going to introduce myself to the patient. Hi, my name is Purvis. I'm a University of Manitoba student nurse, and I'm going to be doing your dressing change today. So after I introduce myself, I'm going to go ahead and ask them their name and their date of birth. They will tell me, and then I'll just go ahead and verify that on the wristband. I'm also just going to ask them about allergies, and I'm just going to note that I've already asked them if they wanted any analgesic prior to this procedure. They said no. So after I've done all of that, I'm just going to go ahead and I'm going to explain the procedure a little bit to the patient. So I'm just going to be explaining to them what we're going to be doing, what we're going to be using, and asking them if they're okay with the procedure. So I've explained everything. They said they're okay with the procedure, so that's good. I can go ahead. So once I've done all that, I'm just going to go ahead and position the patient. So making sure that they're in the semi-Fowler's position with their arm raised above their head. I'm just going to go ahead and raise the bed to the proper waist height, the side table to the proper waist height as well. And then we're just going to go ahead and we're just going to expose the patient. And I'm just going to lay out one of these blue pads just to catch any garbage and moisture that might come from this procedure. So after I've gone ahead and done all that and everything is ready to go, I'm just going to go ahead and I'm going to set up my tray here. So just for purposes of not having much room, I kind of have things spread out. So I'm making sure that I'm only touching the outer 1-inch border so we don't break sterility. Go ahead and grab these, and then I can open this up. So the first thing I'm going to do is I'm just going to go ahead and I'm going to pass myself this straight. I'm going to put that there. And we're not going to be using this, so I'm just going to go ahead and set it aside because I already put out my blue pad. So from there, I'm going to go ahead and hand myself this garbage. Okay. And then I'm just going to ask the patient if it's okay if I set this up on their bed. They say that that's fine. Okay. So from there, I'm just going to go ahead and I want to start adding stuff into my field that I'm going to need for the procedure. So the first thing that I'm going to do is I'm going to need a couple of the IV drainage sponges. So I'm just going to go ahead and use that. And I'm going to just drop this into my field. Throw that in the garbage. And then just a couple of the normal 4x4s. Go. Garbage. And then the last thing, or second last thing, sorry, is we're going to be putting weighing this back. And obviously I'm just noting that this would normally be a new one, but for purposes of this demo, I'm going to be reusing. So I'm going to go ahead and throw that in the garbage. So after I've added all of that, the last thing I'm going to add is just my normal saline. So we're just going to add this, making sure that we don't drip any onto our sterile field, just for cleaning. So that's good. So after I've added all of that, I'm going to go ahead and I'm going to perform hand hygiene, and I'm going to put on a pair of clean gloves so that I can take off the old dressing. Okay, so I'm going to go ahead, and the first thing that I'm going to do is I'm just going to note that the tubing is intact and it is properly attached and everything is flowing properly. So after I've done that, I'm just going to go ahead and I'm just going to palpate for any subcutaneous emphysema. We don't feel any popping or any crackling. So after I've done all of that, I'm going to go ahead and I'm just going to make sure that I stabilize the tubing while I do this, so we don't move it out of place. So once I've got that off, we're still just going to stabilize the tubing. I'm going to pull this off. So the whole dressing came off all at once with the sponges, the two IV sponges. So I'm just going to note that we don't have any drainage on this, so that's good. That'll be for my documentation later. So I'm just going to throw that in the garbage. So now I'm just going to take my tweezers and we're going to remove the jelonet, and we're just going to throw that in the garbage along with the tweezers. And then I'm going to be taking off these gloves and I'm going to be performing hand hygiene. So at this point, I want to go ahead and I just want to assess the insertion site. So we're going to be assessing for, we don't see any signs of edema or erythema. The peri-wound skin looks dry and intact. We don't see any signs of infection. We don't see any drainage or there's no foul odor. So once we've inspected all of that and everything looks good, we're just gonna go ahead and wash our hands again, and we are gonna go ahead and put on our sterile gloves. I asked the patient if it was okay if I did this at the end of the bed, and they said that that's fine. So put in the garbage. Okay, I just want to make sure those are on good and tight. Okay, so now that that's done, I'm just going to leave that there for now, and now we're just going to go ahead, and the first thing that we're going to do is we're going to want to be cleaning this. Okay, I'm just going to put this stuff over here for now. So the first thing we're going to want to do is we're going to want to make rosettes to clean around the insertion site. So our first rosette. And one wiper swipe, so just right on the inside here, and one surround. And then we're gonna do another one. And we're gonna do a little bit farther on the outside here, and one wiper swipe. And then we also wanna make sure that we clean the tubing as well, so that's what we'll do next. So we're going to do under the tubing, and then I don't have any 2x2s left, so we're just going to use one of these bigger ones. And we're just going to wet it, and we'll do the top of the tubing. Okay, so now that I've done all of the cleaning with the normal saline, we're gonna go ahead and we're gonna dry it. So I'm gonna use these 4x4s again. And we'll do wiper swipe, so one surround. And then just one more time just to make sure that we get it nice and dry. Okay, so now that that's all done, I'm going to go ahead and I can get my jelonet ready to apply. Throw that in the garbage. In the garbage. Okay. I'm just going to use one of my forceps here. Okay. I'm just going to hook it under where we've already cleaned. Okay, making sure we got a good seal there. Okay, so once we've got a good seal, I'm going to go ahead and I'm going to put on our, just doing them 2 different ways. So we'll do one this way, and then we'll do one this way, making sure that we're not touching. There we go. Okay, and then from there, I'm just gonna go ahead and I'm gonna put my 2 4x4s on top. Okay, so at this point, I'm gonna go ahead and be using my mefix. So I'm gonna go ahead and I'm gonna take off these gloves, and I'm gonna perform hand hygiene. And then I'm gonna go ahead and I'm gonna get my mefix. So we have, I'm just gonna note that I've already dated and timed this and put my signature so that they know when it needs to be changed again. So we're gonna do this one first. just gonna kind of pull this over here so that we can do the proper tenting. So we're gonna pull this over here, and then we're gonna go ahead, we're gonna tent this around, and then we're gonna make sure that it's nice and solid on there. So that's perfect. Okay, so after we've done all of that, I'm gonna go ahead and I'm gonna grab all of my garbage and I'm gonna put this in the garbage. I'm gonna collect all my bedside supplies and make sure that everything's clean. I'm gonna reposition the patient. I'm gonna make sure that they're okay, ask them about any pain levels and make sure that they don't need anything. So from there, I'm gonna go ahead and I'm going to lower my patient's bed, make sure that we do my exit safety check, call bell within reach, side rails up as appropriate. So from there, I'm gonna go ahead and I'm going to leave the patient's room and I'm gonna make sure I document. So I wanna make sure I document exactly what we used for the procedure, what we took off, what we put on. I'm gonna make sure that I document how the patient tolerated this procedure, as well as all of the information that I documented when I looked at the wound, so assessing the wound and all that kind of stuff. On the IPN, any wound care sheets that might be important, and also just any other pertinent information that might be important at this specific hospital for their policy. And then after I'm done all of that, then I'm done.